Now it is time to discuss about the diagnosis of tetanus, because in previous video we have completed about the different type of tetanus. So now we will start the discussion on the diagnosis of tetanus. So it will be a very small video. So let's start. So first kind of test is clinical test, where we will going to use a wooden spatula. That is why the name spatula test. With the help of this spatula we will try to touch the posterior pharyngeal wall, okay, and then we will observe the effect. A positive test will result in involuntary muscle contraction of the jaw or beating down hard on the spatula due to lower threshold of the muscle spasm in patient with tetanus. So I think you can understand that when I have talked about the mechanism of the tetanus spasmin, how tetanus spasmin causes spastic paralysis, there I have told you that there is no inhibition of the muscle contraction, right? That is the key word. That is why there will be a lower threshold of the muscle spasm, okay. And a negative test will observe a normal gag reflex, okay, the normal gag reflex. So this is the spatula test. We are using a wooden spatula to touch the posterior pharyngeal wall, okay, of the jaw. And if you observe the involuntary contraction of the jaw or beating down hard on the spatula due to lower threshold of the muscle spasm in patient, then you can conclude that patient may infected with tetanus. And if you observe normal gag reflex, then it is a negative test. And you can also find tetanus toxin in serum, and that can be easily detected with the help of immunoassay or bioassay. Let's say for example ELISA test, okay. And culturing Clostridium tetani becomes very difficult, because I have told you in very first video that tetanus Clostridium tetani is anaerobe, right? So, and they will take very much time for their growth. Not only that, you should have a proper infrastructure for the culturing of Clostridium tetani, because they are obligate anaerobe. Remember it very carefully. That means oxygen is toxic to them. So you should have a proper infrastructure for their growth, okay. A type of infrastructure that will ensure the environment which is free of oxygen, okay. So that is the environment that we have created in our college. So inside this petri plates we have cultured the anaerobic bacteria, okay. And when the flame will be extinguished, it will ensure that the entire environment in the inner side of the jar is free of oxygen, okay. And then we have to at least give 7 days for their growth, because they will take too much time for their growth, and also we have to ensure a oxygen free environment, okay. That is why culturing Clostridium tetani is very difficult. Not only Clostridium tetani, any kind of anaerobe, okay. That is the 3 kind of the diagnosis. One is spatula test, where you are using a wooden spatula and you are trying to touch the posterior pharyngeal wall of the patient. And if you are observing involuntary muscle contraction of the jaw, then you can say the test is positive. Or if you are only observing a normal gag reflex, then you can say the test is negative, okay. And you can also find tetanus toxin using serum, okay, and along with the culturing process is also present, okay. So that is the diagnosis of tetanus toxin or diagnosis of the tetanus, okay. So we have just one topic left that I will cover in next video, that is the treatment of the tetanus. So thank you for listening to this class.